Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. Thank you so much for joining me. I really appreciate it. It's going to be a great show. It's a beautiful day. It's going to be wonderful. And, of course, it's a lot of that is a mindset. And so, you know me, I'm always positive, and I'm always looking on the bright side of things, and hopefully I can impart some of that onto you. Today's show is a tour, back scenes tour, if you will, of the James Cancer Hospital and Solove Research Institute with its chief physician, or physician-in-chief, Dr. Richard Goldberg. All right, and hey, before we get to that, let me tell you if you want to follow me on Twitter. You do that by going at Dr. Kvitko. And if you'd go to my office Facebook page and like us, that would be awesome. Before we get started with the show, let me remind you it's not too late to help me help Rotary, help our community by buying a Win with Rotary 2016 calendar. It's $20, and even though we're already part into January, you will still get 350 to 356 chances to not only win your money back, but to win hundreds of dollars, because each calendar is numbered and each day of the year. When the Ohio Lottery Pick 3 number is drawn, that will determine who wins. And in fact, I've already had a winner. One of the people that bought a calendar from me has already won. So they've at least won their money back. And so if you want to do that, call my office at 262-9588 and order yours today. All right? Okay, so I've mentioned a couple times that we're going to be doing this show, and it's very exciting to me, and I'm finally happy to be able to bring it to you. This is going to be part one of a two-part series. So let's go ahead and listen to the interview I did with Physician-in-Chief, Dr. Richard Goldberg of the James Cancer Hospital and Solove Research Institute. All right, so I came to the James Cancer Hospital and Richard Solove Research Center. Is that correct?
That's our correct name. You can read it on the side of the building as you're driving up or down 315. So Art James was the physician from Columbus who went to Sloan Kettering to do some training, came back to Columbus and said Columbus needs a cancer hospital like Sloan Kettering.
Wow. And by the way, this is Dr. Richard Goldberg. You are the physician-in-chief of the James.
That's correct. So I helped to run the hospital with a team of physicians and administrators. I also see patients with GI cancers, particularly colorectal cancer, and do research in that area as well.
So if you're the chief, how many Indians do you have? How many people are you responsible for?
Well, there are actually over 1,100 doctors that have consulting roles in the hospital. About 200 of our physicians spend at least 80% of their clinical time taking care of cancer patients. So those are our core physicians. 1,100
and then 200 almost full-time.
Right. And one of the great things about a cancer hospital like this that Dr. James saw was that we have doctors who really concentrate in very narrow areas. We know more and more about a narrower and narrower field.
We used to call that more and more about less and less, right?
Right. And so I've seen a lot of patients with colorectal cancer over my 35 years as an oncologist and have learned from all of them. And I can apply that with the other colleagues that I have here who are surgeons who focus on colorectal cancer or radiation oncologists or pathologists. It's great to have a really specialized team.
So are you able to, literally, you have a case, are you able to go to Dr. So-and-so, Dr. Rocco, for example, and say, what do you think of this? Or is he so busy with his patients that you have to make an appointment?
No, so we have tumor boards. So in GI cancer, because we have 7 different kinds of cancer, we actually have 4 tumor boards. But we have a colorectal tumor board where every Wednesday at 5, 5, a group of about 30 of us, including students as well as practicing physicians, get together and we discuss cases. We bring up the x-rays, we have a pathologist in the room, and everybody gets a chance to think about a case together.
By the time you're doing that, do you already know the diagnosis, or is this determining the diagnosis?
So we already know the diagnosis, and what we're determining is the best treatment plan.
Okay.
Often a patient's case will be presented 3 or 4 times to the tumor board at different stages of their illness.
Tried this drug for the first 4 weeks, and here's where we are. What should we do now? Okay.
Absolutely. And it's actually something I look forward to every week because I learn from it and I get to teach at it as well. So when you walked in the door of the building, you came to our information booth. You were in the Grand Concourse, which is our 3-story high lobby. And what you probably noticed is it's all glass. It's very airy. This building was designed to bring the outside in. It's a really high-tech place. We have an MRI scan between our operating rooms where our neurosurgeons operate on people so that they can wheel a patient from the operating room into the MRI to be sure that they're getting all of the tumor out of their brain. But we don't want it just to be a high-tech place. We also want it to be a high-touch place and a place where people don't feel awed by the technology but cared for by the providers that are here.
Yeah, it's very neat. So a lot of special thought went into the building, the 3-story high, all the glass. It makes you feel more like you're outside than inside, and it's healing, isn't it?
It is. And the other thing I want you to notice is the floors. You may notice that there are some Buckeye symbols in the floor.
I did. They're shiny. They're like aluminum or something.
Right. And there also is a lot of scarlet and gray here.
Just like me.
Yeah, so same color scheme that you're usually dressed in as an Ohio State grad. And we have to give credit to the Wexners for that. The Wexners know their business. They know how to make people aware of brand, and they wanted us to be sure that people knew that they're at Ohio State when they come to the James Cancer Hospital.
So that was part of their request when they gave the gift. I think they gave $100 million, if I remember right. And so you just had to agree to, for instance, the conference rooms have scarlet and gray chairs, and everywhere you go, you're reminded.
That's true. And we're proud to be Ohio State, and Ohio State is proud of the James.
Yeah, really. Now, tell me about in this lobby here that we're in. It's this huge area, but it doesn't look like a lot of activity in it. There's all these cars coming and going. So is this where everybody checks in? What goes on here?
Well, so it's the entry point, but we don't really want people waiting around.
Okay.
You know, our mission is to try and get people to the place where they're seeing their provider as quickly as possible and to be respectful of their time. Having cancer is hard. Having to sit around in a waiting room with cancer is even harder. And so we work really diligently to try and be sure that people move through the lobby to the places where they're going to see their provider.
Okay, I mean, it looks like they're moving through the lobby faster than when I try to check into a Las Vegas hotel. Am I right?
We'd like to think that our service is better than the Las Vegas hotels.
Okay, so we have this main entry point, and then what happens? Do people they get their diagnosis and they're brought in? That's how people come to the James? Is there ever a time when they're brought in an ambulance for some reason?
Well, so we have a number of ways you can get here. You can call up and ask for an appointment. You can be referred by your doctor, or you can be admitted through the emergency room. And one of the unique features of the new James that wasn't true of the old James is we have our own cancer emergency room. Now, that's not very common across the country. First of all, the James is now the 3rd largest cancer hospital in the country. You have to have a big place in order to have your own cancer emergency room.
You're right.
And we have a group of emergency physicians who want to concentrate on cancer. And in fact, we're just opening a new fellowship program that will train ER doctors to be cancer ER doctors.
Really? Really? That's like new.
Well, it is new. It's not even accredited yet, but it's on the leading edge of education in medicine. And it's something we're proud to be doing. The only other hospital that we know of in the country that has its own cancer emergency room is at MD Anderson in Texas. We're the 3rd largest cancer hospital in the country. They're the largest. It's only places in that league that can really do something like this.
Okay, now, I'm a little bit confused, though, because I thought when people had cancer, they got a diagnosis, the biopsy came back positive, and then they come. Why they didn't cut themselves, they didn't get in a car accident and need an emergency room. How do cancer patients need an emergency room?
Well, sometimes we don't know they have cancer until they come to the emergency room, and we either suspect it because we feel something in their belly or there's a mass in the breast or something like that. But a lot of our patients that come to the James emergency room are James patients, and they might have an issue like an infection caused by chemotherapy, which reduces your immune system's ability to fight it.
Okay, so they're already in treatment. They've had some horrendous regimen of drugs to kill the cancer cells, and they're having some kind of a reaction or something.
Right. And then, people with advanced cancer often get sick and they have problems with pain or they need an operation, and the emergency room is their conduit in. I can tell you this afternoon that I was involved in helping a patient over at Riverside, just diagnosed with leukemia, get into the James because we have a specialized treatment program for leukemia patients, including the only bone marrow transplant program in Central Ohio. And so even some of the hospitals that sometimes compete with us will send patients to us for the special expertise that our physicians have.
Okay, so you got the call from the physician, maybe the gentleman in charge over there, and said, how do we get our patient in?
Right.
Okay. And I imagine they're probably pretty happy to have the third largest cancer hospital in the nation just about 5 miles away.
Well, one of the things that's been a pleasure about moving to Ohio State, and I've only been here 4 years, I came from the University of North Carolina where I helped to open the North Carolina Cancer Hospital to help open the James Comprehensive Cancer Center's hospital. But one of the pleasures is that the community is so supportive of the James, and the James is supportive of the community. So people are delighted that if they have a neighbor or a friend or a family member that's afflicted with this disease, that right here in Columbus, because Dr. James made it so, we have a hospital of this caliber.
All right, so in a second, we're going to do Dr. Kvitko's question of the day, and you may want to remember that the James is the third largest cancer hospital in the nation, all right? When we do the contest, the winner's going to receive free flowers from Vice Number Florist. But before we do that, we would like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
I was scared of dentists in the dark. I was scared of dentists in the dark.
And now it's time for Dr. Kvitko's question of the day.
Okay, today we are bringing you a behind-the-scenes tour of the James Cancer Hospital and Solove Research Institute. Is the James the A, largest cancer hospital in the nation, B, second largest cancer hospital in the nation, or C, the third largest cancer hospital in the nation? All right, the winner receives free flowers from Vice Number Florist. They'll be delivered to your place of business this Tuesday afternoon. And you will, Tuesday afternoon, yep. And so the number to call, 459-9769. That's 459-9769. So go ahead and call now.
Stay tuned to Dr. Kvitko.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go!
Hi, my name's Athena. My family and I have been patients of Dr. Kvitko and Associates for over 10 years. We've gone to Dr. Kvitko for numerous reasons, especially cleanings, crowns, and root canals. Since going to Dr. Kvitko, I get compliments every day on how beautiful my smile is, and people always ask me how I get my teeth so white. I used to be afraid of the dentist, but Dr. Kvitko and his staff make you feel very comfortable and relaxed, and I'm not afraid anymore. I would recommend Dr. Kvitko for all your family's dental needs.
Call Dr. Kvitko and Associates today, 614-262-9588. Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard.
Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
When I see you smile, I can face the world. When I see you smile, see a ray of light.
All right, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. We are doing Dr. Kvitko's question of the day. We have 4 callers on the line, Cindy, Richard, Susan, and William, and we roll a dice, and it looks like it's going to be Cindy today. Cindy, how are you?
I'm great, thank you. How are you?
I'm well. First of all, thank you for listening, and do you have the answer?
I think I do. I think the James is the 3rd largest cancer hospital.
It is. Cindy, what do you do for a living?
I actually sell plumbing at Worley Plumbing Supply.
Sell plumbing at Worley Plumbing Supply. Awesome. Well, thank you for listening. I really appreciate it. And stay on the line because we need to get the information so those flowers from Weistember can get to your place of business, okay?
Absolutely. Thanks so much.
Here, give that back to my producer, and then bear with him because he's got to stay with me for another second or two. But by the way, the largest cancer hospital in the nation is MD Anderson in Texas, and the second largest is Sloan Kettering. All right, so let's go back to my interview with Dr. Richard Goldberg, Physician-in-Chief of the James Cancer Hospital and Solove Research Institute. And so you mentioned the emergency room, and you're training physicians to be strictly cancer emergency room physicians. Is that going to be a new specialty?
You know, it's not even accredited yet. There's only one other place in the country that's doing it, MD Anderson, but by establishing training programs like this, we hope to have it be a subspecialty within emergency medicine. So we're trying to be on the leading edge of what's happening in cancer medicine.
So your first fellow or fellows, you're training them to work here, right?
So the first fellow who is going to take advantage of this program is a graduate of our emergency medicine residency program, and we're customizing a program for that physician that will include looking at other places. Like this individual will go to Mayo Clinic and will go to MD Anderson to try and see what's great about those places that we can bring back here. You know, one of our main areas of emphasis is educating. We're a medical school. We have residents and fellows. Let me show you our conference room, which is really a wonderful place for physicians and trainees to hear speakers that come from all over the country, all over the world, to talk to us about the latest advances in cancer medicine.
Okay. What is it, just down the hall here?
It is. So here's the room. It's got stadium seating. It's got all the latest bells and whistles in terms of projection. You can see that at every seat there's a microphone so that you can ask questions of the speakers.
Yeah, I'll have to tell you, I was at a CE course. They didn't have that. Most places don't. And they had somebody walk around with a microphone, and I could just tell there were people that would have asked questions, but they would be embarrassed to kind of raise their hand and wait for the person to hand them the microphone. Or, even worse, they hand them the microphone and they don't talk into it. Have you noticed that?
That's true. Well, here you have to work hard not to talk into the microphone because it's right in front of your face. But that's part of education, is the back and forth between the teacher and the students.
Right. Okay. Now, how long has this been open? A year?
So we moved 55 ICU patients in here on December 12th last year.
Meaning 2014.
And then 185 medical surgical patients on the Sunday, December 13th. And on December 14th, we were open for business. Our operating rooms were open. Our clinics were open. So we've been in here just over a year. Now, we projected that it would take us 2 years to be full, and it took us 2 weeks.
You're kidding. 2 weeks? Really?
So we were surprised at the interest in the community in coming to the James, and delighted by the fact that people wanted to take advantage of this new resource. You know, what's special about this place is that we have physicians that really focus on specific diseases. We have floors in the hospital that only take care of certain kinds of patients so that the nurses are trained to take care of a patient with head and neck cancer whose needs are different than a patient with gynecologic cancer or colorectal cancer. Let me show you one of our hospital floors.
Okay. Now, while we're going down the hall, I'm going to ask, if it only took 2 weeks to be full, that makes me think that there might have been either some physicians and even patients waiting, thinking, I'm not even going to tell my doctor about this because I know the James is about to open. Did that happen?
Well, I'm not aware of that story, but I think it could have happened that way. The old James had 160 beds. When we finish the last 72 beds that are currently shelled space here, we'll have 406 beds. And in the middle of the building are 3 floors of intensive care units that are for cancer patients, but also for some patients that don't have cancer. But the floors above that are all specifically devoted to cancer patients. Now, here we are on the 21st floor.
Okay.
We're looking north, and guess what's north? It's the SHU.
Yep, Buckeye Stadium.
So every room on this side of the building has a great view of the SHU. I'm sorry to say that before I got here, they filled in the bottom of the oval. And so we can't see the AstroTurf, but we can see the cheering fans on game day.
And you can make the building taller, maybe add a few more floors?
Well, it is the tallest building on the Ohio State campus, and in my opinion, it's one of the biggest billboards in town.
Yeah, you can't miss it.
That's true, Everett. When you drive up or down 315, it's obvious that the James is here.
Now, okay, so people, they get their choice. They can either be on the side where they have the SHU, or what's the other side?
So the other side is a great view of downtown Columbus, and you can see all the skyscrapers in the financial area and the business area of Columbus. You can also get a look at the Olentangy as it goes by and at some of the Ohio State buildings. So this is one of the head and neck cancer floors.
Okay.
People with head and neck cancer, obviously, you know a lot about as a dentist. You often are the first person to notice that somebody has a mass in their mouth or in their gum. And it's a very specialized area because the surgeries that are required for these patients, the reconstructions that are required for these patients take an incredible amount of skill. And not just skill on the part of the physicians, but also skill on the part of the nurses that help to manage these patients. And I have to say one of the greatest strengths of the James is its physicians, but one of its other greatest strengths is its nurses and other caregivers that cluster around every patient who comes for our services.
Yeah, that's really neat, and I can attest that I'm only as good as the people around me when I'm trying to do a procedure. If they don't know, if they can't anticipate what I'm going to need next, there's a delay, maybe the numbness is going to go away. You just have to, everybody has to really be on task, and that's what you have here.
Yeah, we work in teams. Cancer medicine is a team sport, and when I talk to our new employees, I emphasize that every day at the James is game day. Just like game day on Saturdays in the fall in the SHU.
There are no redos, right?
There are no redos, and we expect every one of our players to be at the top of their game every day.
Oh, I do.
Right, I was going to come live. Yeah. All right. So if you're just joining us, I'm Dr. Kvitko. We're here at the James with Dr. Richard Goldberg, and we'll be right back.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
When it comes to the overall health of your teeth, trust the experience of Dr. Kvitko and Associates. From dental cleanings and exams to restoration, dental implants, and pediatric care, Dr. Kvitko and Associates can give you something to smile about.
There's a lot of places out there that offer discount dentistry, but at Dr. Kvitko's, he actually takes the time.
See what Dr. Kvitko and Associates can do for you. Conveniently located on High Street in Clintonville, call 262-9588 or online at drkvitko.com.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
That's why I smile. It's been a while since every day and everything has felt this right. And now you turn it all around.
Now, you said that you're full, but then earlier you mentioned something about 72 shelled rooms. What does that mean? Those are rooms that are ready to go, but they're not ready to use?
Well, so they have the plumbing and they have the electricity. They don't have walls yet and they don't have furnishings yet. So this was an expensive building to build. It cost about $800 million to build it. We deferred finishing 72 rooms. We need about $35 or $40 million to get those rooms finished. We're busy finding the money to finish those rooms because we could fill them with patients right away.
Wow, and when a university goes to find money, is it from donors or is it bank financing? I just don't really know.
Well, so it depends. This building was built by bonds sold by Ohio State University. Now, we did get donations in addition to that, but the state didn't pay for the building. We're paying for the building.
Okay.
Having it full makes our accountants happy because we have a $53 million a year mortgage. I don't know how big your mortgage is, but my mortgage is big.
It's a lot less than $53 million, I can tell you that. It feels big, but not anymore now that you told me what yours is. So it would seem if you're full that it would be almost a slam dunk because you can say, hey, help us build these other 72 rooms, we'll fill those as well, almost like a good credit rating kind of a thing. But are they taking a wait and see to make sure that the bottom doesn't fall out or that you're really going to stay full or what?
Well, it's an interesting thing. The university is about a $4 billion a year business, and every part of the university has needs, not just the cancer hospital. Now, we believe that money ought to go first to the cancer hospital, but there are people with dissenting opinions about it.
There are probably some people at the dental school that think some of it should go to them, right?
Right. And so we have to justify our expenditures, even though so far the demand for our services has exceeded our expectations.
And so people from all over the country are coming here, all over the world, or do you track that?
We do track that. We actually have what we call a destination medicine program that helps to bring people from around the country and around the world to Ohio State for services. It's complicated if you're trying to come from Paris or from London or from Abu Dhabi, as some of our patients do, and we want to be sure that when they get here, everything is orchestrated for those patients. The same is true for somebody coming from Florida or New York or Chicago. When you come to a new town and you've got a diagnosis of cancer, we want things to run smoothly for you.
So you would want to make sure family members have a place to stay and they know how to find and where to park and how long they're going to be here and how they can communicate with loved ones back home, that sort of thing, like concierge.
Yes, all of that is, this is a concierge-type service for those individuals. Now, the next area I want to show you is our bone marrow transplant floor. So bone marrow transplant is something that's done mainly in patients with blood cancers. And, of course, the bone marrow is the factory that makes the blood. If that factory has cancer in it, then one of the approaches to treating it is to give very high doses of chemotherapy that essentially eliminates all the bone marrow.
Wow. So then
either give those patients back their own bone marrow, which you've cleansed and stored in a bag in a freezer, or you give them a donor's bone marrow. And it often will take those patients 6 or 8 weeks for their bone marrow to reconstitute. And they're in the hospital all that time.
Wow. Are they alert? Are they up and around? Or are they very sick the whole time?
Well, so often they're up and around feeling fatigued but not particularly ill, except that when you ablate the bone marrow, you make people susceptible to infection. And so if they get an infection, that can make them pretty sick. As a consequence of that, we keep them here on the 14th floor. You'll notice as you look out the windows here that not only do you see downtown Columbus and see the shoe, but there's a garden on this floor.
Yeah, I remember reading about that, and it's pretty neat. You can just, I don't know, it looks like a patio, hotel patio, except there's no pool.
Right. And we would have a pool, but our hospital infection control people wouldn't let us do it.
Oh, come on.
You have to be very careful about the sorts of things that you expose people who've had a bone marrow transplant to. But here we're able to allow them to get access to a little bit of greenery under controlled conditions so that for the 6 to 8 weeks that they're in the hospital, they're not completely isolated from the natural world.
Okay.
Okay, so I want to thank Dr. Goldberg for the first part of that interview. Second part will be next week, so don't forget to tune in. Be sure to join me next Sunday and every Sunday morning right here on your favorite station. Goodbye.
Before we leave, let me tell y'all a little something. Before we leave, let me tell y'all a little something.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.
WSNY